for the people that don't know, what was the revenue of your first year in business?
Easily $1 million. My main service right now is healthcare staffing.
Okay.
So what I do is I get contracts from hospitals, nursing homes, retirement homes. There's a lot of money out there for all of us to make. All of us. We can all be millionaires. We can all be billionaires.
Yeah.
It's the mindset.
Exactly.
You know, you have to be hungry, man. I'm hungry for success.
Yeah.
If I want, I can retire today.
Yeah.
But no.
Everything black on black. If I studied that facts on facts.
Welcome back to another episode of the Black is the New Rich podcast. And today we got a very special guest because honestly, this show is mainly about things outside of entertainment, whether that's entrepreneurship or mindset, and not the typical things like somebody playing basketball or somebody in the like acting world or entertainment world, because there's a lot of hustles out here that we need to know. So today we got a guest with a very special hustle and I don't want to mess it up. So can you please introduce yourself?
Thank you for having me. My name is Marvin. I am the CEO of Marv Cares, which is it's a home care service providing company. We do a lot of home care staffing, a lot of personal home care, a lot of we're gonna get into it. I'm not gonna give you guys too much, but
okay,
this is black is the new rich.
Okay,
you know what I'm saying? So
damn right.
it's amazing to be here. Thank you for having me. I appreciate it. This is a great platform.
Thank you.
Really great.
So just quickly, you have Marv Cares. Can you just name the types of services that Marv Cares has?
Okay, so Marv Cares is pretty much, mainly my main service right now is healthcare staffing.
Okay.
So what I do is I get contracts from hospitals, nursing homes, retirement homes all around Ontario. And what I do is, because there's a healthcare shortage of staff. There's always been a healthcare shortage of staff in the nursing industry, right?
Yeah.
And people don't know that. People didn't get to know that until when COVID came, right? Mm-hmm. But it's always been there. It's always will be there and it's always going to be there.
Yeah.
So I get those contracts and, I put together a team of nurses, a team of PSWs, and, I subcontract them to these homes to fill in those gaps that need to be filled in. That's the main service that is booming right now.
Yeah, okay.
And the other thing is private home. Private homes, like I can get a PSW or a nurse. Mm-hmm. For example, if there's somebody out there that has a parent, a parent can't do things on their own, I can get a private nurse to go there and spend time with them on the day, give them their meds, make sure they get their meals, make sure, day-to-day activities are being done, especially people that are vulnerable, seniors in the homes,
Okay.
And same thing with the PSW program, things that nurses can't do, PSWs will do them.
Okay, amazing. So I'm going to get right back into that in a second, but first I want to get into the lead up. Yeah. How did you get there? What's the background?
That's a very good question. So originally I went to school for nursing. I went to college. I did my diploma in practical nursing.
Yes.
And then...
did you do it down here?
Yes.
Okay.
I went to Georgian College in
Barrie. Yeah, Barrie. Yeah.
I went to Barrie and I did my nursing out there. I graduated and, when I graduated, I got a job as a nurse manager at a long-term care in Scarborough. Mm-hmm. I didn't like it much, I don't like settling for less. So my aim was to get into a hospital. Yeah. So I got into a hospital in downtown Toronto. I was in ICU, COVID hit. And then
that
when
must
COVID
been crazy.
hit, it was crazy.
Yeah.
I got like 10 years experience in just those 2 years of COVID.
Yeah.
I got a bunch of experience and I was overwhelmed and, the 7 to 7 shifts were not.
Yeah, you're working those 12-hour shifts.
12-hour shifts, man, and it's crazy. You go up when the sun is on, you come out when the sun is gone, it's crazy. But so I did that for about a year and a half. And then, I decided I needed a change. And my change was Marv Cares. Mm-hmm. One time I was in the lunchroom with my colleagues at work and I was just, giving them the vision. I'm just telling them like, hey, you guys, what do you guys think about this? We can start a home care service providing agency. I laid down the vision. sadly my colleagues didn't believe, but one thing about me, when people don't believe, it gives me the drive.
Yeah.
I'm hungry. You know what I'm saying? I'm hungry. And I pushed it on, and it got to where it's at right now. And I'm grateful. I'm really grateful.
you look grateful.
I'm very grateful. And those colleagues that, that didn't believe in the vision, now they reach out, they want to get in, they want to get into it. And, we're having the talks. Yeah.
Because when I was doing my research for this episode, it made me think of my stepfather, because he's been in Emerge for probably like over 20 years, still working those 12 to 12 shifts. And he's in his 50s like he was when he was 24 years old. And I could see the toll that it takes on him, especially the 3 days off that he's sleeping through those whole things. I'm just like, this sparks an idea like for me to bring back to him, like, hey, have you ever thought about something like this? Because you're working way too hard at your age. And I just feel like nurses are not properly taken care of, in my opinion, because I feel like with all the trauma that you guys see and witness, like, first of all, there's no like therapy programs, mandatory programs. And I feel like that's a problem in itself, and just the hard working labor. What do you think about that?
You're very right, man. You're very right. And to your grandfather, man, it's never too late to get out those shits, man. I'll tell you that. It's never too late, But one thing that I notice, there's people that have been in those jobs for a very long time, and I won't say they're comfortable, but
they're hardwired.
They look at it in a way whereby, okay, I've been doing this for years. I have a pension coming. You know what I'm saying? It's guaranteed that bi-weekly you're going to get your paycheck, and you know what you're going to get, how much you're going to receive. And they have mortgages. These are reasons, as when I was trying to come up with Marv Cares, these are reasons that my colleagues were giving me as to why they wouldn't, take the risk.
Pensions.
They're like, I need a paycheck every 2 weeks. If I live here and I don't have a paycheck in 2 weeks, what am I gonna do to pay my mortgage? What am I gonna do to pay my bills? I need to see the income coming in. But it's all about patience, man. As far as the workload goes, it's a lot of work. It's a lot of work. It takes
a lot of managing.
Mentally, yes, it's mentally draining, emotionally draining. I'll tell you, when I used to work at the hospital, there's a day, one of the worst days in my career, I lost 3 patients in one day. Back to back, know. And the way it works, you lose one patient, you go on a break, you come back, you already have another patient waiting for you. You know what I'm saying? And they're just dropping out easily. It's just life. But like, that's a field that you choose. Nursing is from the heart. It's not something that you can just go to class and learn and that's it. I've seen a lot of people do it, but when you don't have it in you, you're not going to be successful at it. You know what I'm saying? It's rooted in the heart. It's compassion, love. You know, you need to have the love for it. The patience for it.
Okay. So your business is basically the middleman. You get nurses, different types of nurses, and you get clients that need help.
Yes.
Right. So in Ontario and Canada, are those services covered by OHIP, or do people have to have a different like healthcare service or package?
OHIP doesn't cover anything but your hospital bills.
That's it.
I'll tell you that.
Okay.
But although there's different programs that are ventured behind that. Like for seniors, they could get a private caregiver. Depending on what their situation is. Everybody has a different situation, but OHIP does not cover any of those private services.
So you're gonna have to have your own money as a client.
Yes, or insurance.
Health insurance. Yes,
health insurance.
Okay.
Right? And it's OHIP is not it, man. It's not what we think it is. Because even though like my grandmother is getting older now and she doesn't have health insurance, and I'm seeing the way they treat her, and I'm like, geez, this is not good. And because she's always telling me, make sure you get your health insurance, make sure you get health insurance, because when you're my age, you don't want to go through these type of healthcare systems. So I got that, right? And so now if something happened to me, I would be looking at someone like you.
right?
Absolutely. Marv Cares.
Okay, so for someone wanting to start this business, right? Actually, before someone wanting to start, what sparked your idea other than you being in the nursing field, and who helped you say, put this kind of business plan together?
So when I was working at the hospital, I had part-time jobs.
Okay.
I was working with agencies as well, and the agencies that I was working for, when I used to meet my bosses or excuse me, the people that own these companies, they had no medical background.
Yeah.
I'm speaking healthcare language to them and they don't understand. I have to break it down. They'll send me to a client and you come back to give a report and you have to break it down and they don't understand anything.
Yeah.
And I'm like, okay, how did you get here?
Yeah.
And they just, if they'll tell you happily, like, man, it's business.
Yeah.
I'm just doing business. I don't need to know what you guys do out there.
Oh, wow.
And to me, that like really struck me, like, okay, this guy is cashing out, but I'm the one doing the work.
Yeah.
But I have more knowledge about it, Now imagine somebody that has knowledge about it, getting into it and understanding everything. And I think Marv Cares stands out to all my clients. It really stands out because when I go out there to make these pitches, I'm not only making business pitches. I'm talking like I'm more interested to know what kind of clients they have. What kind of residents are in the home. What are their diagnoses? What's going on? I need to know. So
more
the
ins and outs.
Yes,
and that's your advantage.
And that's my advantage, right? So when I get on that table and I sit with the clients, and they see, okay, he's not just a businessman, but this is somebody that truly cares. Yeah. And, from that conversation, things go really well. Really smooth.
So you don't necessarily have to have a medical background to start a home care business.
No, you don't.
Gee, so I can literally tomorrow get information and start.
Yeah.
Okay. So for the person that doesn't necessarily have a medical background like you, what is the very first step that they would need to take to look to open up their own home care business?
First things first, man, do some research on home care. Know what you're getting into. You need to understand it. You know what I'm saying? You need to understand it and know the basics.
What are the basics?
You need to know, like, there's a lot of people that don't know there's two different types of nurses. Yeah. They don't know that there's actually three nurses. There's a nurse practitioner. Yeah. That one has a master's degree. Okay. In nursing. There's a registered nurse, which is an RN. That's a degree. Yeah. And then there's a RPN, registered practical nurse, which is a diploma. So those are three types of nurses. And then below that, we have the personal support workers. Yes. Those ones that support, And then we also have healthcare attendants, A healthcare attendant can be somebody with a high school diploma that assists a PSW, that does things that, that are not strictly medical. It can be like a maid. Okay. Pretty much,
And you deal with all of them?
Yes, I deal with everybody. I deal with everybody. I like to include everybody. I don't like to leave people out.
Yeah.
But for somebody that doesn't have a medical background, you need to do some research. Don't just get into the business with the aim. Yes, the money's there. Yeah. There's enough money for all of us to make. Yeah. But a client will be more impressed if you have some sort of knowledge. Okay. Okay. About,
if you have some empathy to what they're doing and
to what they're looking for, something.
And you're not looking at them like just a check.
Yeah, you're not looking at just giving them an invoice and expecting the invoice to get paid. Yes. Because, you lose the contract in a short period of time. There's contracts that I've had ever since I started the business and they're still going on. That does not last well in this type of business. Okay. People usually lose their contracts after 3 months. It can be a 3-month contract, 4 months, 5 months, 6 months. But me, because of the way I take care of things and understand the business, it's just like, oh, that Marv Cares is great. We can always rely on them. They know what they're doing. So like the contract is ongoing. God knows. Is it for life? Jeez. Who knows? It's still gonna go on.
Okay. Right? Okay. So How long have you been in the business for, this side?
This is gonna be my second year of
Okay.
business. I started this business when I quit my job at the hospital. I was just so tired, and I went home that day. The day that I lost 3 patients is the day that changed my life forever.
Yeah.
You know what I'm saying? I went home, I sat on my balcony, depressed, and I just started writing things down.
Yeah.
You know, and I'm like, yo, I work for an agency. I can start my own agency.
Yeah.
And I just started putting things on paper, just writing it down. And then the thing about me, my background, where I come from Uganda. You know, in my childhood, I didn't have everything.
Yeah.
You know what I'm saying? There's times that I was walking around bare feet, no shoes.
Yeah.
You wear the same clothes for a week. You know what I'm saying? So like coming to a country like Canada.
Does it look easy to you?
It is easy.
Yeah, it is easy.
You have everything right, you know, right under your nose. It's up to you to go get it.
Yeah.
You have to be hungry, you know. There's something that I learned here that my uncle taught me. You see those plates, those license plates on the cars that we drive. There's something that says yours to discover.
Ontario.
Ontario, yours to discover. And I've carried that thing on in my life, and it's actually like
True.
It's true.
Yeah. Because I always ask people that come from abroad and end up doing well in business. I always ask them, do you think we're spoiled and too privileged?
Hell yeah.
Yeah.
Hell yeah.
Because you've capitalized on an idea in 2 years. Yeah. So for the people that don't know, what was the revenue of your first year in business?
Easily $1 million.
Easily. And that's with mistakes as well?
Yes.
Okay, so let's talk about some of your first year mistakes. What were you?
So first year mistakes. First things first, nobody taught me the business.
Yeah.
I knew somebody that is in the business, and I reached out to them to give me some kind of guidance, some kind of knowledge, and they were not willing to give me the knowledge. You know, they were asking me like, oh, you have to pay me. You know, I went to meet them, and they made me wait in their office for over 4 hours.
To not give you any game.
To not give me any game. And when I finally got a chance to speak to them, they said, just ask me questions. I'm not going to say anything. Just ask me questions. I'll answer.
So basically knowing that you don't have all the answers, so you can't ask the proper questions.
Exactly. I don't know nothing.
Interesting.
Yeah. So the questions I was asking were basic questions.
Yeah.
Literally. What do you do? Well, register company.
Yeah.
Everybody does that.
Yeah.
You know, how'd you get contracts? You have to look for them.
Yeah.
Very dry and vague answers, you know.
Yeah.
And I was just really angry after that meeting, but I was grateful for that meeting because for somebody to give you their time of the day, it's a lot, right?
Yeah.
It wasn't as beneficial as I hoped it would be, but definitely, you know, something that motivated me, gave me the anger to be like, okay, I have to go get it on my own.
Oh, geez.
I gotta go get it.
So let's break it down. So for example, if you have a client, give me a problem that one of your clients may have.
Right. Okay, let's say big clients or...
Yeah, let's go from a smaller client and then a bigger client case.
For example, I would say, let's say a friend of mine, say a friend of mine, Ben, has a grandma and they don't want to put their grandma in a
home.
In a home care.
Yeah.
You know, they don't want to put them in a senior's home. They want them to stay home with them, right? But Ben and his family have jobs and everything demanding. They have kids and they don't have the time. And let's say the grandma is diagnosed with dementia, you know, and they need extra support. They might not have the patience. Yeah. And dementia is really...
It's damaging.
It's damaging.
Yeah.
You know, damaging, not even the people around them, right?
Yeah.
So what Ben can do, Ben can reach out to Marv Cares and, it will kind of come up with a care plan for their grandma. What do they need on a day-to-day basis? What do they have to do? Is there activities that they, you know, they're enrolled in, you know, pretty much is to have somebody with them all the time so that when Ben is at work, he's not worried about his grandma at home.
Okay.
He's at home by herself, who has dementia. She doesn't know what she's doing. She's forgetting every 2 seconds, right?
Yeah.
So Marv Cares is able to have somebody there 24/7.
Yeah.
You know, to watch them.
Okay.
Feed them.
Yeah.
Make sure they get their meds.
Yeah.
And to kind of like engage them in activities, you know, to kind of help them mentally, because like you said, dementia is really damaging.
Okay.
It's an old age disease with no cure.
Okay.
There's no cure for it, right? Once your brain is dead, it's dead.
That's it.
That's it.
So then once the person taking care of his grandma signs a contract, right? So do you get the money from the insurance company and then you pay your let's say the nurses or the necessary nurses? Is that how it works?
I don't have to wait for the client to pay me because a client has
insurance.
Yeah.
So you get the contract from.
So I'll sign the contract with the client, right? Yeah. And I'll get the worker to start working. Yeah. Right. When you issue an invoice, they have a 30-day period.
Okay.
To pay that invoice.
The client.
Yes.
Okay.
The worker is not going to wait for 30 days. You have to have the money.
Okay.
To pay the client, and then whenever the client to pay the worker, and whenever the client sorts you out, whenever they sort you out, you're good. But I have to always have the money to pay my workers. Yeah. Whether the client.
So where does that come from? That's what I'm asking.
Where does the money come from?
Yeah. I'm getting right into it.
So in the beginning, when I started the business, I had some money saved up.
Oh, so you had to pay out of pocket?
Yes, I had to pay out of pocket. Pay my workers out of pocket.
Yeah.
You know, I had to get loans from friends.
Yeah.
But the beauty about the business is you see the money.
Yeah. Return.
Yeah. Okay. The money's coming.
Yeah.
It might not come when you need it.
Yeah.
But you're rest assured that it's gonna come.
Okay.
So even finding the money, it's hard to go up to somebody and ask them like, hey, I need 50K. Yeah. You know, like 50K. Yeah. What do you need 50K for?
Yeah.
Like, hey, I gotta take care of some business. You know, people don't give out money.
Yeah.
I have friends that really have good jobs and they make money, but I couldn't approach them like to get money from them. You know? So it's hard. But when you get somebody that has the money,
the backing,
they're willing to help you, and they're gonna get it, let's say in a week, 2 weeks. Yeah. You're gonna bring it back, you know, and then you wanna hold on to those people. When I started out, I had like 10K. Yeah. My first payout.
That's not bad.
My first payday was 25K. I needed 15K more.
You had on top of the 25?
Yes.
Okay.
Yeah. So I had a friend of mine, a very great friend of mine. I'll always treasure that guy, man. Yeah. And he had the money and he knew what I was into. He had an idea of the business and he's like, okay, it's definitely gonna come back. Yeah. He's like, okay, I want some interest on top of that. I was desperate.
So you took it.
Yeah, I took it. I'm like, sure.
But you know that's
I'm like,
back.
okay, sure, you give me this for that. Okay, it's gonna get me somewhere, right? Yeah. Because if I pay them, they're gonna keep wanting to work. They're gonna work more, right? Yeah. Because they're seeing they're working hard and they're getting what they deserve.
The
right?
nurses.
Yeah.
Okay.
Okay, pay them. Like, okay, one thing I don't do is I don't mess up people's pay. Yeah. If it's Friday and somebody has to be paid, I make sure they get paid. Okay. And the numbers are correct. Yeah. And nobody's gonna be out there and looking at their paycheck. They've worked 100 hours in 2 weeks, you know, and they're looking at their paycheck and it's not adding up. You're not gonna be so happy.
Yeah, right? yeah.
So I make sure the numbers are always correct.
So
always.
So what different jobs do you have within your business? Are you handling everything when it comes to payroll, admin?
Yes.
Really?
I do it all, man. Yeah. Like I said, I told myself the business. I feel like before I start hiring extra help, I need to know
everything in and out.
In and out.
Okay.
You know?
So maybe year 3 and 4, you'll start thinking about that?
Yes. Very soon. Because right now the workload, we've grown bigger, you know? Yeah. we've grown big. I have over 30 staff members.
30. And those are constantly working?
Yes, 24/7.
Holy.
24/7.
So let's talk about it. Let's talk about the marketing. How did you get those workers?
It's easy.
Yeah.
There's people looking for jobs out there day and night.
Yeah.
There's people looking for jobs. So in healthcare, we have platforms. You know, we have
to see who's available.
Yeah, who's available. There's WhatsApp groups. There's Facebook groups.
Oh, so they're everywhere.
Everywhere. You know what I'm saying? And like just like connecting, like, okay, the people I went to nursing school with, you know, they might know somebody or themselves, or some of the people that I went to school with work for me as well.
Yeah.
You know? And just like you expand your network. Everywhere that I worked before I started Marv Cares, I expanded my network. I got connections, you know, and networking with people, and you just
build relationships.
Yeah, you just build relationships.
So that even goes to like my next question. How important is it to relationship build and nurture those relationships?
It's very important because it's nursing. Like I said, nursing is rooted from the heart.
Yeah.
You know? So like first things first, before you provide care to a client, you need to build a relationship. You need to build rapport. You know what I'm saying? So you need to have that relationship with your client. You're not going to have a relationship with a client and not have a relationship with a coworker.
Yeah, exactly.
It's teamwork.
Exactly.
You know, we work hand in hand.
Yeah.
You know, and we depend on each other. So relationships, not just at work, but everywhere. Like when you're in this field, it's everywhere you go. Like even in public, you know, people always tell me like, oh my God, you're so good with people. You know, you connect with people easily. You know, you're outgoing, but like, that's just me. That's
you as a person.
That's me as a person. Okay. And then when you add it to what I do, it
makes sense.
It makes sense.
So do you feel like you're in your purpose right now at this position?
Yes.
So that
I feel like this is my calling.
Yeah?
Yeah. This is amazing. My calling. I feel like I was meant to do this, to be honest.
So let me ask you a question. So with year by year, your revenue's increasing. How do you stay humble and grounded and remember your why?
You know what? The first few months when I started seeing the money coming in, I was getting a bit excited. Yeah. You know, I wasn't believing it. Yeah. You know, I wasn't believing it, and just, but then I remembered where I come from, you know, and where I came from to reach to where I'm at today. And I'm like, okay, let's say if I can make $100K in a month, okay? Yeah. If I can make $100K in a month, that means like the next month I can make 200. Yeah. So I'm like, okay, don't get excited. Stay humble. Yeah. Beat the odds, do numbers, and remain humble. Yeah. Literally, like that's how I ground myself. I speak to myself because I see it a lot. I see a lot of people get money and they think they're on top of the world. When you have because they feel like money is power. It can be in some cases, right? But like once you lose that money, it's gone. Then what? It's like a guest. Yeah. It comes and goes. Yeah. Today you'll have it, you won't have it tomorrow. You know what I'm saying? So like, how do I humble myself? It's just my background, man. I came from nothing, so I know I can lose it all. Yeah. But can I get it back? Probably. Probably yes. Probably not. Yeah. God knows, you know what I'm saying? So like, I just got to stay humble at all times.
So another question is, how do you, in terms of marketing for clients now, how are you doing marketing when it comes to clients?
Okay. It's a very good question. Mainly what I do is I can make 100 calls a day.
Okay. Cold calls?
Yeah. Yeah. I can make 100 calls a day and just call different homes. There's thousands and thousands of homes in Ontario. Yeah. Hospitals. You know, there's lots of people out there looking for private caregivers. Yeah. Looking for nurses, you know. And you just sometimes put up ads. Okay. You know, you target those areas, you target these towns, these senior towns, these towns where you go by and filled with a bunch of seniors. Yeah. You know? Okay. So you target them. There's times where I have to drive my car and go on the road like, okay, I'm gonna go to Stratford.
Yeah.
I'm gonna go spend a week in Stratford.
Yeah. And just talk to people.
And just talk to people.
Yeah.
You know? Just you might meet a nurse that works at a local healthcare center there, and she could know clients through clients that she's taking care of. And she could know clients and she could lead you to somebody.
Okay. So when I was doing my research for this episode, right? The guy that I was listening to, like, he gave some game on how he gets clients. So I wanted to tell you on this podcast. So what he does is he does something called lunch and learn. So what it is he'll go to different corporations and he will say, hey guys, I will provide you guys with a nice catered lunch. Yeah. While I speak what I do, like, you know, I teach you guys about like this healthcare system, blah, 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 while they have a nice lunch. So he just goes from corporation to corporation and getting in those buildings. Yeah. What do you think about that?
I think that's amazing. I think that's very amazing, you know, but it also depends who's willing to give you their time of the day. And who's willing to listen to you.
Do you find like it's hard, like when you're talking to people about like your services, do they look at you like, what is it? What type of...
You know what? It's very hard because look at it this way. When I go to these towns where I've gone to and they act like they've never seen a black person before.
Okay.
You know?
So you have to break that barrier first.
Yes. That barrier has been my whole life. My whole entire life in this country.
Yeah.
Like, that's always been a barrier, but I'm so over it. Like,
you have bulletproof skin to it now.
Yeah.
So how do you navigate those conversations? Like, how are you easing them up to be like, okay, I actually care?
You know what? I don't give up easily.
Yeah.
I just don't give up easily. You can call me all the names, you know, all the names you want, but it doesn't break me. If I have a message that I'm trying to get to you.
Yeah.
And you're trying to protect yourself from, you know, not getting that message. After our interaction, let it be positive or negative. At the end of it all, you're going to want to come back and want to know more.
Yeah.
What were you saying, sir?
Yeah.
Like, oh, I'm just here. This is what I do. You know, I'm just in town. And, you know, and things kickstart off that, but like racism is a disease.
100%. I agree.
It's a big disease in this country.
I agree.
You know.
So I heard you talk about this earlier, and you were like, the guy that you're asking questions, he was kind of being stingy with the game.
Yeah. And
I feel like a lot of people don't have a mindset of abundance. And what I mean by that is that, you know, there's plenty clients for everybody, right? So in this industry, would you say that there's still a lot of money out here for other companies?
Absolutely. You know why? They're building a lot more homes.
Exactly.
You know, they're building a lot of homes. There's seniors every day. You know, there's people retiring. There's every day, you know. So like the market is wide. If you're out there and you want to get into this, get into it, man. Don't procrastinate. Yeah. Do not procrastinate.
So what do your work days look like?
I work 24/7.
Geez, so what does that look like?
24/7.
On the phone, calling people?
Phone, emails, everywhere, you know.
Are you on site at any of them, or?
I do my rounds.
Yeah.
I do my rounds. I don't need to be on site, but I just have to make sure people are out there they're showing up to the shifts on time. Like right now I have groups that I'm not worried because they love to work.
Yeah.
You know?
And those are your solid people.
Solid.
Yeah.
I have a team of all black people.
Oh, that's amazing. That's amazing.
I love it.
Yeah.
And you know, when I look at it, I relate to you guys. Yeah. Black is the new rich.
Yeah.
Know? And my team proves that.
Yeah.
If I was able to bring my entire team on this podcast, I would. But that means we wouldn't be making money. Yeah. That day we'll just have to take a day off and nobody will be at work, right?
I love that.
The goal is to make money in your sleep, man.
Yeah. And that's you're getting passive income right now.
Yeah. And to me, it's like, if you're doing something, you have to own it. You know? You have to own the craft.
Yeah.
If you're out there and let's say you're a truck driver, you're driving somebody's truck, you know, Why don't you own your own truck? Why don't you own your own trucking business?
Yeah.
You're selling clothes, female clothes. Why don't you own your own brand? Own your own brand. As small as it could be something.
Yeah.
I'm not going to sit here and say Marv Cares is big. Marv Cares is not big. There's bigger companies than Marv Cares.
But still rev the mill first year.
Hey, man. Now I look at that mill like it's nothing.
Yeah.
Now, the more you get, the more like you want more. Like,
yeah.
I'm hungry. Like I don't settle for less.
Yeah.
1 million. If I can make $1 million last year, I can make 2 million this year.
Exactly.
3 million, 4 million.
Exactly.
And it's doable.
Yeah. So what would you say your next steps are to get to that 2, to scale?
Just keep growing. More contracts.
More contracts.
More contracts.
Do you need more inside people to handle admin stuff or more?
Right now, yes.
Yes. Okay.
Right now,
that's what I was thinking.
Right now, yes. Because I started this thing by myself. It's a one-man show.
Yeah.
Right?
And you're controlling all these pieces.
Yes.
Okay.
And I have people that work for me and they've never even met me.
Yeah.
At all. Like we've never met eye to eye. We've never seen each other.
Yeah.
But
so how does the hiring process go when it comes to the nurses?
So the hiring process is I do a background check. You know? So you submit your paperwork, Of course, I need a criminal record, I need to do that. I contact the CNO and kind of like pretty much CNO has a system. You can just go on the website. Yeah. Let's say Corey Cash is a nurse. I can go on the CNO website, put in your names.
And see all my background.
Just see everything, everywhere you've worked. And it's right there,
So that makes it a lot easier.
Yeah. If you ever made any errors, it's on there too. It's open to the public.
Jeez.
Right?
Okay.
So like the hiring process to me is...
the easier part, I guess?
It could be easy, but also like... I like to give everybody a chance. Yeah. So when I send you out on an assignment, I get feedback. Yeah. I do weekly meetings with the clients. Like, okay,
how did this person do?
Yeah, how is so and so doing? Is there any concerns? Yeah. Anything I need to know, and even the worker themselves. I also do. A meeting with them and hear what they have to say. Do they like the place?
So you're doing a lot of mediating too.
Oh yeah. A lot.
Oh, geez.
It's very necessary.
So you're the organizer, you're the therapist, you do it all.
I do it all.
Geez, so then okay, so take me through again. I just want to make this super clear. So tomorrow I want to start Corey Cash Cares, right? And I go to one of my boys, I'm like, hey, you know what? Can you back me right now with, let's say, how much thousands right now? How much? Give me a number. At the start, 50?
To start?
To start.
No. 50 is a lot.
Okay. 30? 30?
20.
20?
Let's say it's 20.
20, I can be okay?
Yeah, let's say 20.
So I'm going to ask, bro, I need this loan. I'll give you an interest on whatever I'm making. And then I'm going to go do my research on the ins and outs of the company, right? And then my first step, you said the first step was to do your research. So let's say now I have the knowledge. What's the second step to actually get this on the ground?
So once you identify, you have your knowledge.
Is there a license that I have to get?
No license.
Okay.
No license.
Oh, that's crazy. Yo, that's crazy.
You register the company. Yeah. Register the company. Make your calls to the government. Make sure that what you're trying to do is what they know what the government knows.
Oh, okay. Right? So make sure you're transparent. Everything that you're doing. You have to
be super, because this is healthcare.
Yeah. There's a lot of liabilities on the line.
Yes, there's a lot of liabilities on the line. Be transparent to them. Get on the phone with them. And they're paid to do this. They provide you all the necessary information that you need to know. Okay. Literally everything. Ministry of Health. Reach out to them as well. Okay. There's a Ministry of Long-Term Care. Yeah.
The information is literally, it's all out there.
It's out there. This is what I'm saying. Canadians are spoiled.
Yes.
You have everything. Yeah. Everything. Yeah. Right under you, and you're just not using it to your advantage. Jeez. There's a lot of money out there for all of us to make. Mm-hmm. All of us. We can all be millionaires. We can all be billionaires. Yeah. It's the mindset.
Exactly.
You know, you have to be hungry, man. I'm hungry for success.
Yeah.
If I want, I can retire today.
Yeah.
But no.
Yeah.
I can go. If I can keep going.
Yeah. And you want more staff members.
Yes.
More clients.
Yes.
Okay. That's crazy.
Yes.
So let me ask you a question. When it's all said and done, right? What type of impact do you want to leave on the world?
When it's all said and done.
When it's all said and done.
Ooh. Ooh. It's a very good question.
Even I'm thinking of like I can't put myself in your shoes,
right.
but I'm even thinking of thoughts of like back home even.
Yeah. Speaking of back home, like right now, because the government recently came up with something whereby, you know, they're making it easier for internationally educated nurses to be able to come here.
Oh, amazing.
And still practice.
So you can have the funnel.
Yes.
That's big.
Yes. So right now I'm in the process. I just came from Uganda. I was in Uganda about 2 months ago.
Okay.
I'm from Uganda, you know, and just doing some groundwork and see, you know, talking to
different people
and seeing how I can launch that. You know, I'm able to bring nurses.
That'll be crazy.
Home to bring them here.
And you can that's a big bridge and that's a big gap that you can fill for especially for you. How do you say it? Ugandians?
Yeah.
Yes.
Yeah.
That's big time.
Yes.
So back to the question.
Yeah.
Now, how do you want to be remembered when it's all said and done?
When it's all said and done, I just want Marv Cares. Like Marv Cares has nothing to do with me.
Mm-hmm.
Yes, my name is Marvin, but Marv Cares, it's marvelous care.
Marvelous.
Extraordinary.
Yeah.
That's what we do.
Yeah.
I want Marv Cares to be one of the biggest, I would say, internationally, home care providers, home care service providers in the world. You know,
Jeez.
It could be here, it could be in Uganda, it could be in Jamaica. Like I'm tapping everywhere.
Okay,
everywhere
and you're hungry right now. I can see it.
I'm hungry.
Yeah,
I'm hungry because I feel like I've broken a lot of doors that people had shut down on me, and nothing breaks me, man. Nothing breaks me down.
I love that. So for people, and I'm gonna ask you a personal question. I don't know how you're gonna take it, but you said you graduated in 2019.
Yes.
So do you mind saying your age on here?
Oh, nice. I just turned 30.
30.
A week ago?
Holy shit.
I just turned 30 a week ago.
30.
Yes.
And you've done this for 2 years.
Yes.
So you started at 28. Okay, that's good to know because I want someone to watch this episode and be like, wow, like I'm in my late 20s. I can get this popping from now.
Yes. It's never too late, man.
It's never too late.
It's never too late. Anything you put your mind to, trust me, you can do it.
Amazing.
If you believe it, you can achieve it.
100%.
100%.
And it's yours to discover.
And it's yours to discover all the way.
Okay.
You know?
Okay, so the last two questions, it's two questions that we ask everybody on the show. I want to know what's the best advice that you received and what's the worst advice you received. And you don't have to say any names.
The worst advice that I received was when you tell somebody you want to do something and they tell you, they're like, it's too soon, man. It's too soon.
Bruh.
Wait. Take your time.
That's you.
Like,
Patience.
wait. It's too soon. No. What do you mean it's too soon? I can do it. I'm going to do it.
And is your work pace fast?
Yes.
Yeah. Okay. Because I'm like that too. Yeah. So like we're opposite, but I think it works well because I'm very fast paced, but he picks up on what I leave behind.
Right.
So it works.
Right. The thing about me is if I get a phone call right now, like, hey Marvin, we need 2 nurses to come cover shifts, full-time hours. right there and then, I'm trying to find those 2 nurses.
Now. Yeah. Because that's money.
That's money.
Yeah.
And it's by the clock.
Yeah.
It's per hour.
Yeah.
And I'm trying to find those 2 nurses right away. I go through my networks. I broadcast a message. And Corey, within 5 minutes, the phone is ringing like crazy.
Jeez.
Like crazy.
Because you sent out the bird call.
Yes. I'm like, okay, send me your paperwork. Let me have a look. At your tracker record. And then trust me, within 2 days, I'll have those 2 nurses report to the assignment.
Wow.
Wow.
So you're always on the clock.
I'm always on the call.
Okay, so
always.
You're moving
24/7.
Moving at fast pace. Okay, cool. So what's your best advice that you've ever received?
Best advice that I ever received was to myself. Nobody ever told me this, is that whatever I set my mind to, I can do it. I told myself that, and it's never let me down, never. Whatever I say I'm going to do, I do it, and it's a success,
Because you did the unimaginable. Like, you went to school, you thought you were going to be a nurse, and then you did, at the time that you were doing the nursing, when you first started, did you think you were going to be doing this today?
No.
Exactly.
It never crossed my mind.
Jeez.
Not even once. Not even once.
But you took your pain from the job that you didn't like, and you turned that around and said, you know what, let's find a solution to this, because I'm not going to break my back for years to do this. I'm telling
you, those 2 years that I worked in ICU, filled with a bunch of COVID patients, I gained like 10 years experience.
Yeah.
I've seen things that people that have worked in healthcare for many years, they've never seen before. Or they've never experienced it.
Yeah.
And it's like, whoa, how did I get here? But then it's a pandemic. It's beyond us. Nobody has control.
100%.
And it was incredible.
So basically what it sounds like, that was like maybe the best 2 years for you and your development.
Absolutely.
Because that like opened your mind.
It did.
To possibilities.
It did. 100%.
Jeez.
It did.
Okay. So the last question. So on the show, we like to make predictions.
Yes.
And in 5 years from now, I want to play this back and I'm like, Marv did say he was going to do that.
Yes.
Where do you see yourself in 5 years?
5 years from now.
That's only 35. That's so crazy.
That's only 35, and it's doable.
Yeah.
5 years
5
from
years.
now, I'm going to be living a life that I don't need to take a vacation from. You know what I mean?
Elaborate on that.
A lot of people right now work and they can't wait to take a vacation. They're like, oh, looking forward to my vacation. I have my vacation coming up. I gotta put in my vacation request. 5 years from now, my whole life will be a vacation.
Yeah, literally,
it'll be a vacation whereby I don't need to worry about so and so getting paid. Did this invoice get paid? Did this check?
You'll have a payroll staff to deal with that.
Yes. And I'll just be kicking back with my family.
Amazing.
I'll be a family man.
Amazing.
Spending time with my loved ones.
Amazing.
Raising my kids, and hopefully, the kids can pick up into the business as well and build that legacy.
100%. That's important. Jeez. So, can you let people know where to contact you if they have any questions, or even where to find Marv Cares?
The best way to contact me, man, is Marv Cares, MarvCares.com. That's the best way to go. I'm on social medias as well. My Instagram is that guy, AK. You can send me an email if you go onto the Marv Cares website. You can, send me an email. You can contact me, or you can call the Marv Cares phone. And just, I'm always open to calls. I get thousands of calls a day. So
amazing. And for the person that sees this episode and wants to hit you up for maybe some game,
right?
Are you approachable? for
Absolutely.
that? Okay, amazing.
Absolutely.
Amazing.
I'm always good on saying, fellow people change, All my friends, I want to see all my friends be millionaires.
Yes.
In any way that I can help and support, even if it's just going for a walk, just coming over to my house and we're having drinks and I'm always giving that talk.
Yeah. Like you can do it.
Yes. And I've seen that in my friends whereby every time that we meet and sit and talk, the next time I see them, they have something positive.
Yes. That's amazing.
And it humbles me.
Yeah.
I love to say, like, oh, you're actually listening. That's cool, man.
Yeah,
That's cool. I love it.
That's amazing. All right. Well, I want to thank you for coming on, honestly, because I feel like this interview has been super insightful for me personally.
Right.
Just to know like the ins and outs of this type of business, because I do have a lot of friends. I can name like 3 off the top of my head that are in nursing, but I know they're not thinking this type of way.
Right.
And I feel like this interview can open up pathways of creativity so they can change their life and not have to necessarily do the grind work of that 12 to 12 shifts, because
you don't have to do it, man. You don't have to do it,
because you're literally using your background information and your creativity to create your reality right now. And I think that's super inspiring.
Yes.
So thank you. I appreciate it.
Thank you, bro. Thank you for having me,
No
man.
problem. Thank you.
And this Black is the New Rich. This is a great platform for our community, man.
Thank you.
I love to say this, man. You guys, you don't know how much lives you're changing out there. I'll tell you guys don't know how much lives you're changing.
I appreciate it.
You started from $Black to you.
Yeah. How did you know?
Man, I like to do my homework.
I
like to do my homework. I'm not just gonna come sit here.
Yeah.
No, I like to do my homework as well. And this is amazing.
Thank you.
This is gonna be big.
Thank you. I appreciate it.
In our community, this is gonna be big, man. So you guys keep doing what you're doing.
Thank you.
I'm humbled to be on here. A lot of people want to be up here, but they probably can't be up here because they have nothing to talk about, right? But I'm very humbled, very, very grateful for the opportunity. And I hope that this episode, the little that I've shared with you guys, I hope, you guys pick up 1 or 2 things and just, help you get to where you want to be.
Yes.
If you have a business idea that you've had for years and you have executed it, now is the time to execute it. Nothing is impossible.
Nothing is impossible.
Nothing. We're in Canada, man. Ontario. It's yours to discover.
All right, bet.
Literally.
We're ending off right there. Thank you so much for coming on, brother.
Pleasure.
Appreciate it.
My pleasure.
Jeez.
Everything black on black. If I studied that facts on facts.